So today we'll be talking about cyanide poisoning. So for our case study, we have a 68-year-old female in a hypertensive crisis is being treated in the ICU with intravenous nitroprusside for 48 hours. The patient's blood pressure was brought back down to normal levels. However, she was complaining of a burning sensation in her throat and mouth, followed by nausea and vomiting, diaphoresis, agitation, and dyspnea. The nurse noticed a sweet almond smell in her breath. An arterial blood gas revealed a significant metabolic acidosis. A serum test suggests a metabolite of nitroprusside, thiocyanate, is at toxic level.
So what is nitroprusside? Nitroprusside is a peripheral vasodilator that affects both arterioles and venules and is often used to treat hypertensive emergencies. In order to do this, sodium nitroprusside is broken down to release nitric oxide, which activates guanylate cyclase in the smooth muscle. This leads to an increased intracellular cyclic GMP production, which stimulates the movement of calcium ions from the cytoplasm to the endoplasmic reticulum. This reduces the amount of available calcium ions that can bind to calmodulin, a protein that plays a role in smooth muscle contraction. This ultimately results in smooth muscle relaxation and vessel dilation. The metabolism of nitroprusside with hemoglobin produces cyan-methemoglobin and cyanide. In normal doses, this cyanide produced reacts with thiosulfate in the liver and is eliminated in the urine as thiocyanate. However, cyanide toxicity occurs when cyanide binds to tissue's cytochrome oxidase, which blocks the electron transport chain and inhibits oxidative phosphorylation. This leads to metabolic acidosis.
So why is nitroprusside used in hypertensive emergencies?
So what is cyanide? Cyanide can exist in various forms, including a colorless gas in crystal form. It is released in small amounts from natural substances in some foods and plants, such as lima beans and almonds. Pits and seeds of common fruits may have chemicals that metabolize the cyanide, but the edible part of the plants contains low amounts of these chemicals. Gas is used to exterminate pests and vermin in ships and buildings, and was even used as a genocidal agent by the Germans in World War II. Why do the chemicals that metabolize the cyanide from pits and seeds, a common fruit, not kill you?
Cyanide can be introduced into the body through inhalation, skin absorption, or ingestion. It can also enter ecosystems through natural means or industrial activities. People who work in cyanide-related industries, such as those that manufacture paper, textiles, and plastics, are at an especially high risk for cyanide poisoning. However, the most common source of cyanide exposure is thought to be cigarette smoke. The amount of cyanide, the length of time, as well as the method of introduction to the body determine the severity of the cyanide poisoning. Inhalation of cyanide gas causes the most harm, especially in enclosed spaces.
What are the three main ways that cyanide is introduced into the body?
Cyanide poisoning can cause several different kinds of symptoms. Acute symptoms include dizziness, headache, nausea, and vomiting, rapid breathing, rapid heart rate, restlessness, weakness, smell of bitter almonds, metabolic acidosis, diaphoresis, agitation, and dyspnea. Severe symptoms include convulsions, loss of consciousness, low blood pressure, lung injury, low heart rate, and respiratory failure leading to death. Survivors of severe cyanide poisoning have displayed heart, brain, and nerve damage. What are the common acute symptoms of cyanide toxicity?
Due to cyanide's effects on the electron transport chain, the body cannot generate energy through aerobic respiration. Instead, anaerobic respiration, specifically lactic acid fermentation, takes place. This causes a drastic increase in the formation of lactic acid and hydrogen ions, resulting in a lowered blood pH and metabolic acidosis. Symptoms of metabolic acidosis are agitation, diaphoresis, and dyspnea. The burning sensation in the patient's throat, coupled with nausea, vomiting, and dyspnea, is due to the increase in acidity of the blood. Vomiting is the body's way of expelling acid from the stomach, counteracting the rise of hydrogen ions and raising the pH. Rapid breathing also occurs as a response to acidosis. By removing CO2, it shifts the equilibrium to form more carbon dioxide, following Le Chatelier's principle, and further rising the pH of the blood.
What is dyspnea?
So what causes the bitter almond smell? You may have noticed on movies and police procedural shows that the smell of almonds is often coupled with a diagnosis of cyanide poisoning. Almonds have their distinct smell because they contain a high concentration of hydrogen cyanide. Interestingly, the ability to smell hydrogen cyanide is a genetic trait and not everyone can detect it.
The biochemistry of cyanide poisoning. Cyanide poisoning disrupts the process of oxidative phosphorylation by inhibiting specific complexes in the electron transport chain. The electron transport chain is a series of reactions taking place in the inner mitochondrial membrane that transfers electrons from NADH and FADH2 to O2. The energy released from these exergonic reactions powers proton pumps that move protons from the matrix across their inner membrane into the inner membrane space. The electron transport chain begins with the oxidation of NADH, the transfer of electrons to ubiquinol by the enzyme NADH-Q oxyreductase, or the oxidation of FADH2, and transfer of electrons to ubiquinol by succinate Q reductase. Next, ubiquinol transfers its electrons to cytochrome C through the enzyme Q cytochrome C oxyreductase. The last step is the transfer of electrons from cytochrome C to O2, generating more molecules. The transfer of electrons is facilitated by exergonic reactions that move protons from the matrix to the inner membrane space, thereby creating a proton gradient used to generate ATP, provides organisms with a primary source of energy. What specific function of oxidative phosphorylation is affected by cyanide toxicity?
Complex 4 has two places where electrons bind, heme group A3 and CuB. Cyanide binds to the ferric iron in the A3 heme group of cytochrome C oxidase, inhibiting its ability to transfer electrons and thereby disrupting the function of the electron chain. This stops the body from producing energy through aerobic respiration and ultimately leads to cell death. Therefore, if not treated, cyanide poisoning is lethal.
What part of complex 4 does cyanide bind to?
There are multiple treatment options for cyanide poisoning. The first step is always decontamination. More on that later. In a moderate case, a high flow of oxygen, airway protection, and cardiopulmonary resuscitation are often administered. However, in a severe case, mechanical ventilation, catecholamine, and sodium bicarbonate may be used. Multiple antidotes are available, including sodium thiosulfate, methemoglobin-forming agents, and cobalt compounds. These compounds negate the poisoning by bonding with the cyanide to make a less toxic compound or transforming the cyanide into a less toxic derivative. In patients with suspected cyanide poisoning, hydroxycobalamin is recommended as the first response antidote. However, if severely poisoned, continuous infusion of thiosulfate is recommended.
What are the correct antidotes available for cyanide poisoning?
How to protect yourself, what to do if you're exposed. Cyanide is less dense than air and therefore rises. So if you're in an enclosed space and cannot get out of the area, stay as low as possible. If exposed to cyanide, cut off your clothing and wash off your body with soap and water. Immediately contact the health department and wait for emergency personnel to arrive. They will dispose of the contaminated clothes and then seek medical attention immediately. What should you do if you think you have cyanide poisoning?
Have you ever heard the phrase, drink the Kool-Aid? This is a reference to one of the most tragic cyanide-related events. About 900 people died in the biggest murder-suicide event in modern history in the Jonestown Massacre in 1978, when cult leader Jim Jones convinced his followers to drink cyanide-laced Kool-Aid. Another major cyanide-related event was when 8 people died in 1983 in Chicago from random containers of Tylenol spiked with cyanide. Lastly, cyanide was converted into pill form and given to the Nazi elite to be used as a means of quick suicide if they were ever apprehended.